All right, so what are some of the causes? There's several factors that can be involved, and usually more than one. Part of what I do in my job is I do detective work, working with the clients and helping them explain to me where you think the issues are. And then, so what we're going to try to do a little bit later in the presentation is we'll actually talk about how can we apply that same kind of detective work to a shelter environment. There's some challenges that we have, but it is something that I think we can do. I should also mention is that my work with cats has been, from a volunteer standpoint, has been pretty extensive. About 10 years ago, we started an organization called the Dane County Friends of Ferals, so in the Madison area. And so I work a lot with that organization and dealing, because not only do we have feral cats that we adopt to outdoor home settings, but also ones that tame out that go to indoor homes. So this type of thing is very important to make sure we educate adopters about. And also people who want to surrender animals too. And like I said, in my practice, it's the most common thing I do. But in general, there are two behavioral categories. One is that they dislike the litter box for some reason. And the second is that there's some kind of stress-related behavior. I know it seems pretty simplistic, but that's basically what it boils down to. And we'll get into discussing that in a little bit more detail. All right. Now, causes, examples, medical problems. And you guys, you'll see that I'll stress this over and over and over again. We have to rule out medical issues before we can even begin to deal with the behavior issues. And I'll talk about what we can have as a minimum for our database on determining that. But I cannot stress this enough. But this is the first thing you do, without a doubt. So I can't stress it enough. But you might have infrequent cleaning. I'm also, a lot of my cases that I get, my behavior consulting service, is from other veterinarians. I'm amazed on how many times I'll see cats that they're scooping their litter box once a week. And I'm thinking, and what that says to me is that the people at the vet clinic where they referred them to me hadn't taken the time to ask. Because a lot of people don't know, I remember I had always had dogs all my life growing up. And then when I was in my early 20s, I ended up adopting my first cats. Actually, and you'll see them because one lived till he was more than 20 years old. And I knew nothing about cats. I didn't know where the litter boxes should be. I didn't know how often you should scoop. I mean, it wasn't, and there's some people that just don't know. I know it's hard for us because we deal with cats and dogs all the time.
Do you have any particular...
The question is, do I have any tricks on having people tell the truth? Well, the first thing you do is you ask an open-ended question. One that it can't be answered yes or no. Say, how often do you clean the litter box? So there has to be an answer. Well, every day, once a day. And the other part is when they do respond, don't have a reaction. Look at it as an opportunity to educate. When I'm giving my behavior consultations, the last thing I want to do is to be able to offend one of my clients. What I might do is walk them through it. And I'll say things, and we'll get into this a little bit later, but I'll say, cats' sense of smell is 40 times more acute than ours. So therefore, we have to be very, very meticulous about how often we're cleaning it. So I think the key is to ask open-ended questions, and then just to be very, very non-reactive in their response. Because you want them on as a team member. You want to be working together with them, not offending them. But good question. Okay. So there's a number of different things here, but it might be, they might have an aversion to their substrate. They might have a negative associated with the litter box. This might be associated with, say, for example, if they had a urinary tract infection. How many people in here have had a urinary tract infection in their life? It hurts. I've had one in my lifetime, and I'm hoping never again. But think about this. If you're going to the bathroom, and as you're going to the bathroom, it hurts, the cat starts getting a negative association with the litter box. Then they have that negative association with it. And then say, for example, you have a multi-cat household, and you're just getting on the litter box, and one of the other cats decides to attack you. Or maybe one of the other dogs wants to go and get that poopsicle that you left in the litter box. So that's something that you can have these negative associations. Question over here? No. Okay. But there's lots of different things that can be really make an impact on this. Cats that are doing urine marking, there's usually some outdoor stressors that are going on there too. So we'll review kind of those things as well. All right.